What are some of the trends that you're seeing then overall in terms of private equity getting into healthcare versus physicians going and opening up independent practices? It seems like the pendulum was swinging into the direction of all these practices being bought up by corporate medicine or big health systems or academic institutions. Do you see the pendulum coming back at all? And I guess that is one of the purposes of ease, right? Is to get that pendulum swinging back in the direction of ownership by the physicians.
Yeah, so we're all aware private equity has, and it actually started in the early 2000s where the hospital systems were the ones acquiring private practices, where the early boomers and ones that owned those businesses really used it as a nest egg to be able to sell it off. Previously, they were selling it to other physicians, right? And so a doctor would come in and buy the practice as opposed to a health system coming in and buy the practice. So that is the behavior that shifted. Physicians selling practices has always been default. When someone will start the business, they will be like, all right, I have a growing business. I have a patient panel that's active. I have a good collections happening month over month. I can show you that this is a good business to purchase. Now, who am I going to sell this business to? Sometimes they'll have a new doctor come in, they'll become partner, and eventually that person will take over completely. Or a doctor would come in and just outright buy it. That's how private practice stayed private practice, because there was a kind of pipeline, right? And so what happened is the hospital systems came in. They were the first to go and purchase during this, what we call the M&A wave. And then private equity came in and started doing it after them. And so now there's not a lot of supply where new doctors coming in can purchase an existing business and then modernize it in a sense to help that business grow.